Hello, my name is Leah, and my group members are Stephanie, Cassie, and Janine. We're doing our case study on transient ischemic attack. So, what is a transient ischemic attack? Transient ischemic attack is also known as TIA. It is a type of stroke. A stroke arises when the blood supply in the brain is blocked or decreased. This prevents the brain tissue from getting oxygen and nutrients, which then causes the brain cells to die. TIA is commonly referred to as a mini stroke or warning stroke. It is caused by a small blood clot that briefly plugs an artery. Symptoms do not last very long. They typically disappear within 1 hour, but can last up to 24 hours. What is the cause of a transient ischemic attack? There are many causes for TIA, but the leading cause is blood clots. Other causes include hypertension, which is when the blood travels with an unhealthy force through the blood vessels, atherosclerosis, which is narrowing of the arteries due to plaque buildup, carotid artery disease, which is a blockage within the carotid arteries that causes a decrease of blood to the brain, as well as diabetes and high cholesterol.
So, what are the signs and symptoms of a transient ischemic attack? The signs and symptoms depend on the location of the ischemia. During an attack, the patient stays conscious. Sporadic loss of function in an arm or leg is common. Additional signs and symptoms include visual disturbances, numbness, and paralysis of the face, and aphasia or confusion. These signs and symptoms don't typically last long, so usually a few minutes and rarely more than 1 to 2 hours.
What are the dental implications and considerations of a transient ischemic attack? Medical consult is required if there's an oral infection or a client's medical status is suspected to be unstable. Medical clearance is required if the client has had a TIA within 6 months or is taking an anticoagulant or antiplatelet, as they increase the risk of bleeding. Treatment may be postponed if blood pressure levels do not meet standards based on CDHO hypertension chart. In case of emergency in the dental chair, the dental hygienist should follow the FAST rule. They should watch for facial droop, arm weakness, speech difficulty, and note the time to call 911. 911 should be called immediately when signs present, and supportive care such as oxygen should be provided until EMS arrives.
It's about a 28-year-old male named Jose Rodriguez who is of Mexican descent living in his parents' basement. Prior to, Jose had a beautiful townhome in Toronto, but quickly realized as COVID-19 hit, he was not going to be able to afford living there anyway. He works as a computer tech and is able to work from home as of recent. With this, he's been wearing a lot of pajamas to work and rarely leaves the basement except for dinner time. He typically uses Uber Eats to bring him fast food options when his parents don't feed him. Since he's been working from home, Jose has gained a lot of weight and has recently been diagnosed with hypertension. Every day, he needs to take those medications to counteract the hypertension. Aside from that, the hypertension as a result of weight gain, Jose is a healthy man. So when Jose Rodriguez got to the office for his appointment, he seemed to be quite confused and verbalized having some numbness. When the dental hygienist asked further questions, he begins to slur his speech and mentions he feels a bit lightheaded. This patient is new to the dental hygienist, so they are trying to decipher whether this is normal behavior or if there is something more going on. Approximately 7 minutes into the appointment, it is like Jose's body rebooted, and he was suddenly completely fine. You start to piece together certain symptoms, and with a high blood pressure, you wonder what was really going on when Jose first walked in. So our critical thinking questions, our first one is what could have been going on with Jose in those first few minutes? The second is what are the key differences between stroke and transient ischemic attack? And the third, what are the next steps that the hygienist should be taking? So your answers for them. So the first one, what could have been going on in those first few minutes? Well, it could be a stroke, and it could be transient ischemic attack, but how do we know that it's one over the other? So what are the key differences between stroke and TIA? Stroke is a brain injury where blood supply is interrupted in a part of the brain, causing tissue to die and brain damage to occur. This causes long-term permanent damage, and the attack itself is usually longer in time. In a TIA, the blockage is only temporary. Blood begins to flow again on its own, so this attack typically only lasts for a few minutes, and the symptoms rarely last longer than a couple of hours. There are usually no long-term deficits. What are the next steps that the hygienist should be taking? So as Stephanie said, recognize fast, face drooping, arm weakness, slurred speech, and when it's the time to call 911. And then until, provide supportive care such as oxygen until those EMS arrive. Thank you, and we hope you have a good day.